Hi everybody, welcome back to our channel. Today we're going to be talking about some of the symptoms of COVID-19, when they occur to a mild or moderate degree and how they can be managed at home in that instance.
Hey now, take a step outside and seize the day now. Set aside your worries, it's okay now. The sun is here to stay.
Hi everybody, welcome back to the channel. I'm Dr. Sylvia and this is Ask Away Health, where we provide you with direction and clarity about everything medical. Don't forget to subscribe to the channel and click the notification bell so that every time we publish a new video, which tends to be once a week on Saturdays, you will be notified about it. So let's dive straight into today's topic. We know COVID-19 is caused by the SARS-CoV-2 virus. It causes primarily a respiratory illness. We know that majority of people who contract the SARS-CoV-2 virus may be asymptomatic, that is symptomless, and do not display any symptoms. Another large group of people will develop symptoms, and the symptoms range from being mild to moderate or quite severe and needing hospital admission. So far, with the evidence that is available to date, it is thought that only about 15 to 20% of people actually become so critically ill or suffer from complications that require them to be admitted to hospital. This could be for a number of reasons, but most commonly it has to do with the need for support with respiration and the delivery of oxygen and the use of a ventilator. In this series of videos, however, we're going to be looking at what happens to the majority of cases whereby people suffer from mild to moderate illness, not necessarily ill enough to have to be in hospital, and in many cases being at home to manage those symptoms. Now, this differs from country to country. In some countries, people who develop any symptoms are admitted to an isolation center for observation and treatment. In some other countries, people who develop mild to moderate symptoms are asked to remain at home and self-manage, but with very close access to advisory lines where doctors and other health professionals can provide guidance on what to do with certain symptoms that they might develop, or when it is important for them to attend hospital. So please make sure that you watch all the videos in this series, because I'm going to look at a lot of the symptoms one by one, and I'm going to be putting a link to a little infographic guide that we've developed that just shows you the common symptoms and the available treatments that you can use for self-managing at home. So among the symptoms of the COVID-19 infection that we are aware of are the more common symptoms, which include a fever, which is the same as an elevated or high body temperature. Another common symptom is a continuous cough, which is defined by the NHS UK as being coughing persistently for an hour or more, or having 3 episodes of coughing bouts within a 24-hour period. The other common symptom is one of exhaustion or undue tiredness or fatigue. Now, the less common symptoms that people might experience include a headache, nasal congestion, a sore throat. They might also develop shortness of breath, coughing up sputum, muscle and joint aches or anywhere in the body. They could also experience nausea or vomiting, chills and diarrhea. Of recent, some scientists and ENT, that is ear, nose and throat specialists, have begun to alert us to the possibility of some other symptoms, namely the loss of the sense of taste and the loss of the sense of smell, as being part of the symptom profile of the COVID-19 infection. And they have found that these symptoms could occur in people who do not even go on to develop the other common symptoms of COVID-19, that is the fever or the cough. And they're calling for screening of individuals simply with these loss of the sense of taste or the loss of the sense of smell, as that might indicate people who may already have the COVID-19 infection. People who experience more severe disease may also go on to experience a lot higher temperatures or more severe difficulties with breathing. Such individuals may progress to develop severe pneumonia and acute respiratory distress syndrome, a condition which will require ventilatory support and oxygen delivery, and it might progress to involve injury and damage to other organs of the body. So in the next set of videos, we're going to be looking at the symptoms that people who are not severely ill enough to be in hospital develop and how they can manage them at home. For example, we're going to be looking at the treatment of fever, the treatment of the dry cough and some other respiratory problems that happen along the development of the COVID-19 infection. And then we'll look at the other less common symptoms and how to deal with them at home. So lastly, just before I end this introductory video, I'd like to say that if you develop symptoms of COVID-19 which are thought not to be severe enough to be in hospital, there's some important things that you will need to do. Rest is important, and your body heals while you're sleeping. Make sure you're staying hydrated by taking plenty of fluids. Make sure you're eating nutritious and healthy foods which not only help to boost your immune system but also help to supply the energy that you will need. And there's some helpful supplements like vitamin C and vitamin D that also go a long way to helping to support your immune system. A question that we often get is, well, how long is this going to last? What is the duration of the illness? So for people who are at home, the duration of the illness might vary from one person to another. On average, from the time of onset of the symptoms to when they recover, for some people tends to be about 7 days or longer, while a lot of other people who remain unwell at home do so for a period of 2 weeks or even longer. Remember that symptoms like cough and fatigue can persist for a while after a viral illness, even when all the other symptoms have resolved. An essential thing to remember when you're at home and managing yourself with COVID-19 infection is, please keep others safe while you're at home. If you live alone and you're managing to cope reasonably well, let friends and family know that you are self-isolating, so they're not supposed to visit you. Obviously, you're not supposed to go out while you're in the period of self-isolation. Friends and family will be useful in helping to deliver groceries or essential medicines to you or to your doorstep while you're unwell. But if you're part of a household, here are some actions you can take to make sure that you're keeping other members of your family or the household safe from contracting the infection. Consider taking up residence in one part of the house and encouraging other members of the family to avoid that space. Wear a face mask if you have one available to prevent others from contracting the infection from you. Ask others to use gloves while they're nursing you or supporting you working in the space around you. Do not share personal items like towels or crockery or utensils with other members of the household. If possible, avoid using shared facilities like bathrooms or the kitchen. And if that's not possible, wait until everybody else is done and then you can go ahead and use the bathroom or the kitchen, and be sure to clean down the area after you've finished. Okay, so that's a little look about managing COVID-19 symptoms at home. Now we're going to start with the next set of videos. Please don't forget to like this video if you found it helpful. Subscribe to the channel. If you've got any questions, let me know in the comment section below. I'm going to put a list of the resources for some of this information as well as the infogram I talked about earlier. Or if you have a question that you want us to respond to privately, send us an email on info@askawayhealth.org. I'm going to see you in the next video soon.